Oh, patients are so surprised. It's one of my favorite things is because at Ezekiel Eyes we fit a lot of the hard contact lenses. So
Mm.
like you're saying, traditionally when patients think of contact lenses, they think of those simple daily disposables. You wear them and you toss them. We fit those at Ezekiel Eyes certainly, but we do a little bit more of the more complicated special contact lenses, which are harder and they actually form a smooth optical surface over the eye. Patients are always surprised when you show them they haven't heard of them before or they haven't seen them before. But I think the main thing that surprises patients with contact lenses these days is just how many problems you can actually solve with them. So these days, the way we view contact lenses is it's not simply an alternative to glasses or it's something that fixes a prescription, but there's so many other uses, particularly in therapeutics. So you can use contact lenses to correct patients that have these really, really irregular eyes where glasses just don't work and they don't get good vision out of glasses. You can use them when the prescriptions are really, really high as well. And you put the prescription into spectacles and they cause this minification or magnification. So contact lenses are great for that. You can use them in patients that are getting a little bit older to give them not only clear distance vision, but you can actually give them near vision as well. So there's special multifocal contact lenses that you can use. You can use contact lenses to treat dry eye these days.
Yeah.
So a lot of patients have dry eye symptoms and they have this discomfort on the front of their eye. And there's these special lenses called scleral lenses, which basically you fill them up with a fluid reservoir and they sit on the front surface of your eye and you have fluid sitting against your eye for the whole day. There's so many different contact lenses these days. There's so many different options. They can deal with so many different issues. They're amazing. I can't overstate the possibilities and the amount of research that's going into the market these days. It's constantly evolving. They can do a lot. They can do a lot.
So do you get patients who come in and say to you, look, Jayden, I tried contact lenses years ago and I couldn't wear them. They're not for me. Has the technology behind contact lenses really changed a lot in recent times? Does some of these people maybe not aware of how improved the latest options are?
Oh, absolutely. It's a pretty common consult that we'll do in clinic in that we'll have patients come in and they'll might have had a bad experience or it just didn't work and they'll drop out of contact lenses for whatever reason. As long as the patient's motivated, in most cases we can certainly find an option. The amount of research that's going on behind the scenes and the amount that these contact lens technologies are developing is crazy. The contact lenses that we're fitting today are nowhere near like the contact lenses we were fitting 10, even 5 years ago. They're so much more comfortable now. The amount of oxygen that you get to the eye is a lot better. The outcomes are just better as well. The optics in the lens tend to be better. Just because you've had an experience in the past, I think the key message would be doesn't mean that you're unsuitable today. I think in most cases, then not. We just have so many different options, so many different things that we can try. If one thing's not working, we can just pivot to another thing. Yeah, it's amazing how quickly things are changing in the space as well.
Today I was at the shop and I bought myself a couple of t-shirts and I was thinking, like, I know we're going to have this conversation today. I was thinking, why isn't buying contact lenses a bit like getting clothes off the rack? Why is getting fitted with contact lenses such a personalized thing, customized thing?
Yeah, it's a really good question. I like to remind myself when we have a patient in the chair that each person that's coming into your chair, not only are they a different person with different experiences, but they also have completely different needs. So I guess it's super important with these contact lenses, especially the more specialized fitting. You really can't take a cookie cutter approach because of how different anyone is. The first thing is anatomically, eyes vary significantly across people. So there'll be different shapes of the cornea, which is the front of your eye. There's different eye sizes. There's different eyelid anatomy. Some patients would have had previous surgeries. Some patients might have had previous injuries. That's just the difference in the eye alone, which you need to account for. Now, the next thing you need to account for is patients' everyday needs. We might have someone in the chair that wants to play golf and they need really, really good distance vision. We sometimes have surgeons come into our practice as well that are operating and they need really, really good up close vision. We might have people for everyday use that need good distance and close and intermediate. So there's so many different variables that need to be taken into account when someone sits in the chair that you really can't just give someone a contact lens and give the next person the same ones. It's such a individualized, personalized thing. And I think that's where my passion for it comes in is if you listen to the patient and you take the time and you're really aware of all the options that are available, then you can get an amazing outcome. It's an art. It really is. It really is.
It's an art and a science.
Yes, yes, exactly.